Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast. All right, you're going to really enjoy this episode. It is chock full of information going deep on the topic of sleep disordered breathing, things that you can do to make a difference if you are having difficulty with your breathing throughout the course of the night, sleep apnea, different kind of cutting edge techniques to address this. So you are going to want to sit back and bring a pen and a paper if you have any sort of questions on these topics or have even faintly considered that you might be dealing with something around obstructive breathing while you're sleeping, or you've even been diagnosed with sleep apnea, or you snore, or you have a partner that snores, or a loved one that snores. Like all of these things, this is the episode for you. And beyond all of that, one of the things that I love about this guest is he is known online on social media as the Biohacking biological dentist, and he is also the father of my good friends over at Biohacker Babes. If you haven't listened to their podcast, fantastic resource. They're such an inspiring family of biohackers that have taken their health into their own hands for many, many years, and just excited to dive in deeper with them on all the topics that we'll get into today. So having said all that, little bit of a background. Who is our guest? Now, Dr. Eugene Sambataro has been practicing dentistry for over 40 years with special interests in orthodontics, dental orthopedics, sleep disordered breathing, and implantology. He graduated from the University of Maryland School of Dentistry in 1980 and soon after started incorporating a more holistic approach to his practice. Dr. Sambataro strives to educate his patients on how they can make healthier decisions in their lives, as well as sharing his knowledge around toxic-free dentistry, which avoids mercury, fillings, fluoride, and toxic root canals. Nearly 80% of all illnesses can be connected to infections, toxicities, and imbalances in the mouth, which is one of the reasons he is so passionate about practicing biological or holistic dentistry. And now let's dive in to learn a little bit more on all of these topics that we just outlined here. And we really just have a blast in this conversation. If you have any follow-up questions, don't hesitate to ask. You can circle back to us over at sleepisaskill.com. If you're not already signed up for the newsletter, definitely get yourself on there. If you haven't taken the sleep assessment kind of quiz that gives you targeted information back, get on over there and do that. We also have a sleep bot on the website too. So, if you're listening and what was that thing they said, or any of those sort of questions, just pop them into the sleep bot. And without further ado, let's jump in. Now, before we get into the podcast, I do want to take a quick minute to give a shout out to our sponsor, BetterHelp, or as I like to call it, a therapist in your pocket. It's the exact app that I used when I was going through my really challenging period of insomnia while traveling overseas. And the ability to maintain a consistent therapist in real life was just really not an option for me since we were jumping around from country to country. So the ability to, with using my phone, have video calls weekly with my therapist, I was paired with I connected with a great therapist right off the bat, but I do know other people who have been able to kind of shop around with some of the therapists on that app until they find a great fit for them. And in between those calls, one of the things that I found was really helpful is that you can also send voice notes, text messages, images in between that, longer weekly video call, so that you do have this really very real ongoing connection and support that I certainly, at least in my experience, hadn't felt with real life therapists that I had used in the past. And also the pricing structure is much more competitive than a lot of the real life therapists that you can come into contact with. So I found it to be a lot of benefits. I recommend it to a lot of people that are just kind of going through struggles in their life or just simply want to be able to up level and bring in that level of reflection and awareness into their life about what's both working and not working. And you can certainly cancel at any time. And for our sleepy community, the BetterHelp company has hooked us up with 10% off if you go to betterhelp.com/sleep is a skill. Again, betterhelp.com/sleep is a skill. And welcome to the Sleep is a Skill podcast. I am just ecstatic to get into this conversation today. I had the opportunity to kind of go back and forth with Gene beforehand, and there is just so much that we've got to get into. And I have a personal connection because he is actually the father of a good friend of mine, Renee Bells, one of the biohacker babes. So I just cannot wait for this conversation. I've been looking forward to this on my calendar. So thank you so much for taking the time.
Oh, thanks for the invite. I think this is a great opportunity to share with your audience. And I've been listening to your podcast. I'm becoming a fan. You're doing a great job for this little area that's been not touched on for really a long period of time. And I think it really needs to be emphasized. So thank you for taking a step forward and creating such a great podcast and
thank you.
Of information.
Yeah. Well, thank you so much for saying that. And as I shared with you, I still have some cringe factor of some of my early podcasts as I'm starting to, get more and more comfortable in this arena. But you got to do what you got to do to get this information out. And I really appreciate the shared enthusiasm on this topic. It's changed my life and the lives of so many of my clients. So I'm excited to hear more because I know you have a passion for this, and that you have been a trailblazer. We were just speaking beforehand. You were playing with HRV back in the early 90s before so many people even knew, and still so many people don't really know what some of these metrics are, but you were doing this way back when. So I would like to turn the spotlight onto you and just have you share a little bit about your story and how you came to be known as the biological dentist and the biohacking dentist. So let us know kind of your origin story.
Sure. So that's been a recent blend because biohacking has become such a common term now that more and more people are finding out about it. And thought, wait a minute, I've been biohacking for 30 years. I didn't have a name that we called it.
Yes.
So, and I don't know if Renee ever related this story to you. When her and her sister were young, they walked into the kitchen one night. I don't know where they were, coming back from dance class or something. And I was at the kitchen table with an ear candle in the side of my head, and my wife was lighting it on fire.
Amazing.
And that was like in the late 80s, like early 90s. So, we had a sauna, I had a pulse electromagnetic frequency, I had a red light therapy. I was using we call it low-level laser therapy then instead of photobiomodulation, same thing now. So I was using all those things late 80s, early 90s. I didn't know it was biohacking. I just thought, well, anything that's going to help you become more healthy, I'm into it. So I'm also I love gadgets and toys. So there isn't anything I wouldn't try. So that was a nice blend with where I had started my journey. Well, I'll take a step back. I graduated from dental school in 1980, did my residency at University Hospital in Baltimore, then went into private practice. So for the first 5 years, I was practicing traditional dentistry, just like we were taught, place mercury amalgams, do root canals, all the standard stuff. In about 86, 87, very close friend of mine from high school, actually my best friend from high school, was diagnosed with a stage 4 melanoma. They gave him 3 to 6 months to live. By the way, he is alive still today.
Wow.
He went the alternative route. But the interesting thing is he came back from his journey and said the first thing that they asked me at this clinic, which was in San Diego, I think it was Livingston Wheeler Clinic. I don't think it's there anymore, but said, you got to get all that metal out of your mouth. And I'm like, what does that have to do with your melanoma or cancer or anything? So I immediately kind of jumped on it. I was always been kind of inquisitive. So I reached out. I was able to find, and it wasn't so easy in those days, no internet. So I found this guy, Hal Huggins in Colorado Springs, who was kind of the pioneer. So that was the journey. So I called him up. I read his book. It's called It's All in Your Head. I still remember sitting on the plane with my wife and Renee's mom.
Yes.
Is a dental hygienist. We worked together for all these years. And I said, God, we're poisoning our patients. We got to stop doing this. So that was the beginning. Although prior to that, we were looking at nutrition, but it wasn't a really big part of the practice. So that was kind of really a change. So then it started, no more mercury. Then later with no more root canals, introducing nutrition into the practice. And of course, once Renee became an adult, she became an integral part of that and actually wrote a chapter in my book. But then in the early 90s, I started looking at mostly snoring because dentistry was now getting into this these Snore appliances, right? Not sleep apnea appliances, but basically Snore appliances.
Sure.
But if we felt like they had more than snoring, we would then refer them to a sleep center. So in the early mid-90s, there weren't many sleep centers. And there wasn't really a very close relationship. So if you referred them out, you never saw them again.
Right.
They never came back. So it was an ongoing issue. My dad was a heavy snorer, separated, slept in different rooms from my mom. By the way, 35% of married couples do live separately because of snoring.
Yes.
So that led me down the journey. And then in 2001, my father died of a sudden heart attack, which not too long before that, he had a stress test, said he was perfect, said he didn't have sleep apnea. I don't believe that. I believe that's what killed him. So that was really the impetus for this particular journey. So it just blended in. So kind of sleep, disordered breathing, sleep apnea, biological dentistry, biohacking. It all kind of fits into one panacea. So that was the drive to then write the book. So I became heavily invested in sleep, disordered breathing, sleep apnea, and all the related things like snoring, upper airway resistance. And so that's been my real commitment, because I believe this is at the main pillar of health. So we talk about nutrition, we talk about exercise. So I think that's the two pillars. The third pillar is sleep. I really think sleep is the foundation, because
Me too. Yes.
Yeah, obviously you do. You wouldn't have a podcast. So good choice.
It's the number one. Yes, absolutely.
So you're walking the
But
talk.
yes.
Yeah. So I thought, geez, I mean, we taught kids even now in schools about nutrition, which wasn't taught when I was a kid, but exercising, although they're getting less of that because they're spending too much time. But, but there's still a lot. I mean, in every corner, there is a new gym opening up, at least pre-COVID there was. Yeah. So physical exercise, nutrition, emphasize. Nobody's talking about sleep. Yeah. Why aren't we introducing this to our children? How to sleep properly, how to breathe. They don't even know how to breathe. So letting kids stay up late, not really investing the right things into their sleeping pattern. So I started to initially treat sleep apnea in adults. And then I thought, wait a minute, we're kind of treating down the road. Let's go upstream and say, what can we do for children so they don't grow up to be adult sleep apneic patients? So that's when we started getting to this program called the Healthy Start program, which we're now doing. So we can treat children as young as the age of 2.
Wow, really?
So that was a long journey, but that's kind of where I am, and it's ongoing. And I love what you said about your podcast. The early ones were, you were still working on it. I'm still working on learning.
It's a forever process. Yeah.
It is a process. It's a great journey. You learn new things all the time. How can you help? And basically, it's all about helping your patient. That's all that, whatever emphasis I put in my education or new toys or new hacks, it's all about making a better experience for the patient and helping them on their journey. So, but we start with, hey, are you sleeping? How are you sleeping?
Music to my ears. Well, number one, thank you for sharing kind of the background and also the personal connection there for you with your father. And, I'm so sorry that went in that way. And it really certainly underscores your commitment to this area of seeing that and having a part of that as your personal story. And so I'm grateful that part of that has seemingly fueled your inquisitive nature around certainly health and well-being, but some of these areas that are just not getting a lot of the airtime that could be available to make a difference. So I'm glad that you are on the forefront of that, and also not just having that be honed into a particular group, but even having that across the board to even beginning at 2 years old from the sounds of it. So that's amazing.
Yeah. And I wasn't going to let my dad's death be the end of it. I wanted to make sure that there was some ongoing legacy. So we actually changed the name of my office. It's just now called the Julian Center for Comprehensive Dentistry, but one part of it is also the Julian Center for Effortless Sleep.
No way.
So that's one of our websites.
Amazing. Okay. Yeah. So fantastic. So it's clear the commitment is there. And also that's part of the reason why I'm so excited to speak with you today too, because that excitement and that always learning does keep you on the forefront. There's no kind of dusty information that you've been collecting from 20 years ago, 30. You're like on, you've been on it, and we were speaking beforehand, and you were aware of all the latest and greatest tools and at home things that you can do and all kinds of stuff. So we're going to get into it. So if you could walk us through, because I think an important thing on this topic is the demystification of some of the action steps that we can take, how we know if we have a problem in the area of snoring, in the area of sleep apnea, and just kind of getting to the root problem. So if you could help us to, one, discern when we need to start taking action, what that looks like, whether it's creating partnership with your doctor, how do we go about all of this, and how does that lend itself to dentistry as well, just kind of filling in all those gaps for people.
Okay. Yeah, it's a great concern because that's a common question. Like, what does the dentist have to do with sleep and sleep apnea?
Yeah.
Oh, wait a minute. Don't they work on teeth and gums and orthodontics? But, this is right in our realm, and every single dentist should be on board for this and get trained with this. We are the first ones to really take an in-depth look in the mouth. Even the ENTs, they look right past the tongue. They look right past the teeth. They're not looking at the palate. They're looking at the back of the throat, and typically looking for pathology.
Yeah.
We're looking at what is the underlying structure that might be contributing to it. Narrow jaws, enlarged tongue, scalloping of the tongue, what we call malampati, where you can't actually see the airway. You can't see the little uvula that's supposed to hang down, the little punching bag. Yeah. So we're looking in the mouth all the time. So for a dentist to be looking in the mouth and not looking at that, to me is just pure malpractice. It's unethical. Even if you don't treat it, you should definitely recognize it. And this is, I'll say, a process. So I started doing orthodontics in 1983. And part of that was extracting teeth, putting on braces, not really looking at what was the undercausing etiology. So orthodontics in many cases is just treating the symptom. You got crooked teeth, you don't have enough room, we'll take some teeth out. Okay. That then progressed, and also on the sideline, treating things like bruxism. People that grind their teeth, we would make an appliance. And inevitably, within 2 years, they'd come back. The appliance was either broken or they wore a hole through it. So we did one thing. We protected their teeth, but we didn't address the underlying cause. So now, with the invention, especially of 3D cone beam technology, we can get, besides visually looking in the mouth, now we have an X-ray. And by the way, it's all those are digital. So for people who are concerned about radiation, yes, it is X-ray, it is radiation. It's much less than probably an hour out in the sun or flying across country. I just want to make that because I know people are always concerned about that.
See, this is why you're such a biohacker, that you even consider that, because so many people would breeze right past that. So thank you for answering that question. It's perfect.
And we have a whole bunch of remedies. Actually, Renee helped me with to counter, like someone before they get the X-rays. So we have some homeopathic remedies and some other things that help block, like vitamin E. So things that really help with blueberry extract, things that help with radiation. But anyway, so it's opened up a whole nother aspect, because now we can visually see the structural component of the airway. So we can look at starting with the nasal passage. We'll get into more about that, I know, because you talk about nasal breathing, mouth breathing.
Sure.
So what's happening here, like, are the turbinates blocked, or is the septum deviated? We can look into the sinuses. Are the sinuses full of fluid? Then we can look into the back of the throat, something called the nasopharynx. And then just below that, the oral pharynx. And that's where you see the soft palate and the tongue. This is where the obstructions occur. So you're going to have an obstruction either from nasal passage congestion or from the tongue and soft palate. And this is what creates that obstruction, which could start out as snoring. So snoring definitely is an obstruction. It's a partial obstruction. So partial air is flowing through. That's what causes that fluttering or that ignoring sound that our spouses are annoyed with. Yes. So that's snoring. But if you get a complete obstruction, which happens more often during REM sleep, because what happens during REM, we're paralyzed, right? So other than our brain is in hyperactivity, just like we're awake, we're in that beta state, but the rest of our body is paralyzed. The tongue is a muscle. So it collapses into the back of the throat. This is when you see the waking up. they don't even realize it. It's the spouse. It's scared to death because it looks like their significant other's taking their last breath.
Yeah. Alarming.
And then the one who's having the sleep apnea event is in total denial. It happens all the time. I don't snore. I don't gasp for air. I feel fine. So you got to really dig deep. And a lot of times and I would say more so the wife reporting about the husband than the other way around. The men are in definite. I am a male, obviously. I agree, but so many men are in denial. They just will not accept that. I don't know. There's some kind of stigma about that. Like, okay, if I snore or I have sleep apnea, I'm not as manly, or whatever it may be. It's a very weak excuse, because when you look at all the different things that happen in sleep. So let's say you're not sleeping, you have insomnia, can't fall asleep, can't stay asleep, wake up, can't go back to sleep. All those things are going to affect you long term. But sleep apnea can have an acute response. You could have a heart attack, and it may be your only heart attack and may be the end of your life. It can happen that quick. And there's certainly many, many reports of people, famous people, Judge Scalia, football players who have died in their sleep of sleep apnea. So this is not something to really take lightly. Now, there are comorbidities that could lead to Alzheimer's, diabetes, cancer, which those are kind of long-term chronic issues. But what about suddenly you die in your sleep? There's no excuse for that, because we have so much knowledge now. It's not worth the risk. Somebody might say, well, okay, well, I'll develop diabetes. I'll deal with that when I get it. But you may not get a second chance. This might be the only chance you have. So that's why I'm so adamant about it. And I think that's what happened to my father, because when you see most heart attacks happen early in the morning.
Yeah. Like cortisol levels
after
up.
A very poor night. Yeah. So no oxygenation to the heart and brain overnight.
Absolutely. Well, one, thank you for underscoring the importance of this, because there can be a lot of lightness that goes, it's snoring. Oh, how the wife is, the husband is, the whatever, and kind of belittling of this, or just, but not necessarily from a place of malice or what have you, but just from a lack of awareness of what this can do over time. And then particularly if beyond the snoring is levels of mild, moderate, or severe apnea is happening, then this is something to really understand has a big implication and impact in our health. So thank you for underscoring that. And you also spoke to some of the different tech that's available now, the 3D, the ability to add that. And when did that come out, by the way?
3D cone beams came out in the early 2000s.
2000s, okay.
Initially, mostly being used by orthodontists.
Sure.
They're looking at jaw structures. Okay. But then we're like, wow, we can see the airway. Why aren't we addressing the airway?
Amazing.
And I always tell my patients, I said, we see these signs. We look in your mouth, your teeth are ground down, you get scalloping your tongue, large tongue, narrow airway. We see it on the x-ray. But I always make it clear, anatomy does not dictate physiology. But there's a high correlation. So if I see someone with a small airway, I've got to ask them the right questions. So we have a whole series of questions to get down to it. And the best way to determine it, and I always say, test, don't guess, you got to do a sleep study. I mean, it's just the bottom line, because I don't know I'm not sleeping next to you. I don't know what's going on. Hopefully your spouse is asleep. They don't really know what's going on. So let's test it. So then we have definitive, objective data that we can make a decision going forward, what's going to be the best treatment for you in particular. And I want to, make it personalized for you.
Sure.
The gold standard is what? A CPAP machine. Some people do great with it. If I get a patient comes in and says, I love my CPAP machine, I don't try to talk them out of it. It's saving their life. They're not using either. When I say CPAP, they make a face like, I'm not wearing that. I forget what comedian said that, the CPAP machine is a perfect birth control device.
So true. Absolutely.
That's so true. It's life-saving. So then we want to give them what are your other options. And we can talk a little bit about that.
Yeah, absolutely. And even on the point of, so if we've established that we might be kind of at risk. And so one, do you have steps that you suggest for people? I have some clients that are single and they say, I don't even know if I snore. They don't even have that level of awareness. Do you suggest certain products? There's like the Snore Lab or different things. Do you have them kind of investigate that topic further? Or do you straight from the anatomy just say, listen, let's just rule out and have you do a sleep lab? What are those steps there?
Yeah, I mean, I individualize it. It depends on kind of their acceptance of it. if there's any financial blocks that might be occurring. Sometimes people want to go the simple way. Most of the time, if not always, I give them my book and I said, read the book. That'll give you plenty of information, and then you can come back. But we do recommend some of the apps like Snore Lab. So in fact, it's interesting you bring that up. We had one patient, he didn't know that he even snored because he lived by himself. He went on family vacation, and on his family vacation, they recorded him snoring.
Oh,
so when he came in, I'd say, you're a little bit overweight. We probably should look at this. So the interesting thing about that is you just never know how close this guy was to having a heart attack. So, they measure the sleep score by what they call AHI, apnea hypopnea index. So less than 5 is considered normal. But if you have a 4.9, you're telling me you're normal. So I don't go much by that. I go more by other facts. 5 to 15 is mild. 15 to 30 is moderate, and above 30 is severe. His was 86. So every hour he stopped breathing for some period of time, 86 times an hour. Sometimes as long as 2 minutes. So this guy was one breath away from a heart attack.
And this is where, because I do have some clients that it just can occur as this big topic and a lot and, sleep lab, and I don't want to do that and all this stuff. But what you're speaking to can really be life-changing. And I'm sure you've seen some of these crazy kind of before and afters where then they get diagnosed as whatever, mild, moderate, or severe sleep apnea. Then they start taking some of these approaches and they lose weight. They're happier. They're rested. It's a whole new world. So
the spouse is much happier.
And the spouse is much happier too. It's like a domino effect. So
because it's interesting because the spouse sometimes has the worst effect from it because they're not sleeping now.
Definitely.
Because they're so worried and you're hearing the snoring. And the actual snoring, the decibels can be so high. They've now done a study that showed it could have auditory damage to the spouse.
Wow.
Yeah. So,
okay.
And you're right. So many people take it lightly. But one good thing is that now people can do a home sleep study. So they don't have to go to a sleep center. I'm only recommend that if somebody I know has severe sleep apnea. But think about, you're going to a strange place in a strange bed. Someone's recording you. How do you sleep and really get good information? So in our at home, you can do it 1 or 2 nights, depending on how many times you want to do it, just to get more data. We look at 4 things. Are you snoring, and to what degree? Are you grinding your teeth? I'm going to talk about the importance of that in a second.
Yeah, please.
Are you grinding? 3, do you stop breathing? How often do you stop breathing? And how often or how far down does your oxygen desaturation go? So you stop breathing, your oxygen desat drops to 70s or 80s. I mean, that's a significant issue in terms of overall health. Just think about, just during the day, if someone came up and started to choke you or put their hand over your mouth and you stop breathing, you're gonna go immediately into that fight or flight, that sympathetic drive. How are you going to sleep if you're in a sympathetic system all night long?
Absolutely. Okay, this is fantastic. So you have that kind of grouping of things that you're looking for. What about, and you mentioned the at home. So when we've discovered, all right, let's just get this tested and rule out certain things or get clarity around the severity of this. So from that place, what are their options? So it's contacting their doctor and then going to a sleep lab. But what are some of the other possible at home or things that they want to be mindful of certain other, because there's other at home kind of gadgets that are popping up that are presumably available to help diagnose these areas, but are there things that we need to maybe be aware of?
Yeah, if you're a real hacker, you probably would, look at Whoop or Oura Ring. Obviously, I'm a big proponent of that.
Yes, mine's charging back here. Yeah.
So that gives you, some data, but it doesn't tell you what your oxygen levels are. And I think that's extremely important. Because it does look at respiration, looks at HRV, looks at your body temperature, looks at heart rate. But what's happening to your oxygen levels? Because that is affecting all those parameters. Mm-hmm. So something like a pulse oximeter, which you can buy online, fairly inexpensive. So just to look to see what your oxygen level, and you can get them that actually have a recording on it. So you can record throughout the night to see if your oxygen's dropping. So before you even reach out to a practitioner. Next, if it is dropping, most people don't know a sleep physician, but most people do have a dentist. That's where I would start. Just ask your dentist, do you treat sleep issues, or do you know someone that treats it? Because there's a lot of dentists that specialize in it now. But that's a good place to start because they have a relationship probably with their dentist, so they can have that conversation. So that's where I would start. And then they could, if they're not able to help you, they can lead you to the right person, to the right referral, whether it's another dentist that, is an expert in sleep apnea or we call sleep disordered breathing. So
Perfect.
That's a good place. So so they can use some at-home things to kind of figure it out. But I think pulse oximeter is probably one of the most important things when you talk about sleep apnea. The Oura Ring is great for looking at your sleep, and if you're getting enough REM, you're getting enough deep sleep, when you're waking up. So, and then what your HRV is, and my favorite thing is the readiness. But but
Same.
I find it somewhat not always accurate. I'll get a high readiness number. I go, I don't really feel that great. I'll get a low readiness number, and I'm feeling really good. So I don't know.
Yes.
So I don't put everything into that.
No.
I think and I don't think you should put anything into one thing. So it's just another tool. So that's where I would start. I would reach out to the dentist because probably everyone has a dentist.
That's fantastic because I think, some people might not, if they're having difficulty night after night, feeling tired, fatigued, reaching out to their dentist might not be in the forefront of their mind. So I think that's important to call out. And so then you take the steps, you get the test, you go through those kind of top 5 things that you're looking at. I know you mentioned too, underscoring a bit more of the grinding element of things, because I do have some clients that, they're anxious, they're stressed, and they say, oh, I don't have a problem with snoring or it's mild, but it's the grinding, and then they have headaches. So what do we need to be conscious about for grinding and sleep quality?
Yeah. So very important to notice when you're grinding. Like if you're grinding during the day, you're probably under an extreme amount of stress.
Yeah.
No doubt. Whatever that may be, whether it's work or family or finances or COVID or whatever you're dealing with. If you're grinding because of stress, and I say emotional stress at night, you got a serious issue. You probably need to do some cognitive behavior therapy or something like that. Most of the time, it's physiological stress. So what happens is when your oxygen levels drop, you go into that fight or flight sympathetic state. One of the ways to counter that, the body's amazing ability, right, to intuitively figure out what to do unconsciously, is we grind our teeth. And in the process of that, it helps to open the airway. So our body is saying, grind or slide your teeth forward or clench down. All that helps to open the airway and provide additional oxygen to the body. So it's all done intuitive. You're not thinking about it. So when we see that, you go, oh, I grind my teeth because I'm nervous, I'm stressed out, or my dentist ground my teeth down. I'm like, no, this is a clear wear pattern. This wasn't done by your dentist. So you're trying to blame it. I said, look, and then we will put that together with those other things we talked about. Do you have a narrow arch? Do you have a high palate? Do you have scalloping of the tongue? Your Mallampati score, which is looking in the back of the throat, all those things. And then let's do a 3D cone beam. Let's look to see what your airway is. So it's always a process of using specific tools and questionnaires and really digging deep. And, sometimes the signs say that it looks like they do have a problem. We'll do what's called an Epworth scoring. So Epworth sleepiness. And if they have a low score on that, it means I don't care what's going on. They're not tired. They're not fatigued. They're functioning properly. Do we need to really intervene? I think I would still do a sleep study just to verify. I think we need to verify because of what I said before, that this could be your last breath. Do we really want to take that chance? I don't think you want to do that. So
absolutely. And one of the things that I've seen for myself and also other clients is depending on where they're at with their sleep, they might, that might be just something that they're swimming in as their regular life. They don't know of what else could be possible. I know, certainly, to use myself as the example, for so many years, I didn't know that having consistent great sleep and what that would even feel like. So I didn't have a frame of reference. So I was like, oh, I'm fine. It's okay. It's good. And so I wouldn't even know what else to compare things to as being possible. So you're making a great point that sometimes, even if our own self-assessments might not be reliable in all cases when it comes to sleep. So sometimes getting that external testing can be really important. Okay. So We're looking for snoring, grinding, when we're stopping to breathe, the oxygen desaturation elements of things. And from that place, so you get your kind of scoring and you get the information. And then what happens? So I know other clients have spoken, oh, this is going to be so expensive. This is going to be this trial and error thing. It's not going to work, blah, blah, blah. So if you can help run through some of the optionality for people, what are their options?
Well, I think from a legal standpoint and ethical standpoint, we always have to mention the gold standard, and that is the CPAP machine.
Sure. Great.
From a financial situation, almost all insurance will cover CPAPs. So
awesome.
Some of them will require them to wear the CPAP for a short period of time if they decided, oh, I don't want to do CPAP, I want to do a dental appliance, which I'll talk about in a second.
Okay.
They still need this period. And now, how do they know they're wearing it? Now they have it with Bluetooth. So they can actually tell where you're wearing it or not.
Oh my gosh.
So you can't just say, you used to be able to say, oh, I hate this thing, I'm not wearing it, I can't wear it, whatever. Now they know whether you even tried to wear it. So they require that you wear it for a certain period of time. And I think that's fine, because if you can tolerate the CPAP machine financially and it's going to save your life, there are some downsides to it. One, not just, we talked about, the issue with having to have this massive thing on your face. You got to travel with it. You got to clean it. So it can be a little bit of an inconvenience. But having this thing strapped to your face can actually push the whole maxilla and mandible into a backward position. I'm going to talk about that in a second, because this is what creates the airway issue. So someone who has already deficiency in their profile, so if we're looking at their profile sideways, we can see that's another sign that we looked at. So we see this kind of dished in face. So having that pressure, that CPAP on you, can actually worsen it over the years. And as it worsens, you need to turn or titrate the airflow up higher and higher. And as you do that, it's drying out the back of the throat. So it's going to be quite uncomfortable. I'm not going to badmouth CPAP because they are truly life-saving.
Sure.
So that's the one. If the second choice is a dental appliance, and that would be something that you would wear at nighttime and pulls your jaw forward, or I should say keeps your jaw from falling back when you're sleeping, especially on your back, keeps your tongue out of the airway. Very effective. It's probably about 90% effective. Not quite as effective as CPAP, but very effective. And a lot more compliancy for some people. Some people are just, I'm not putting anything in my mouth. I don't like anything in my mouth while I'm sleeping. Okay, so what else can we do? You might have to go to a CPAP. I don't want to wear CPAP. So it's like, okay, all right. We may have to do some nasal cones, some mouth taping, teach you how to breathe, sleep properly. So, all those things. And then the third option, actually there's four options. I'm going to give you the fourth one too. The third option is to actually get to the bottom line etiology. Why do you have an airway issue? It's because you didn't get the proper growth and development that should have occurred under normal instances, because in our genomic pattern is that we should all have these wide jaws, just as our ancestors did. And this was work really done by Weston Price in the 1930s. Yes. Most people are familiar with his nutrition background and how he looked at these, cultures around the world. Perfectly straight teeth, wide, big smiles, no cavities. They didn't have any dentists or orthodontists or, they just ate off the land. And within one generation, that all changed. So now what's happening, we're not breastfeeding long enough, so it should be minimum 18 months. 2, we're starting kids off with soft, gooey foods. They need to chew food. They're not going to choke. Parents are so afraid that their children or infants are going to choke. They're not going to choke. We're born to chew food. So give them a raw broccoli and let them chew it, because that chewing capacity, which actually stimulates muscle development and growth of the jaw. So as muscles are strengthened, the jaw adapt to, just like you would for treating osteoporosis, right? Whether you're doing some kind of muscle activity, weightlifting, to strengthen the bone, underlying bone. So you get bone to actually grow. This is the number one reason why kids end up with the need for orthodontics or extraction. So we're addressing both things. One, now we have a child we can treat that didn't get breastfeeding, who didn't chew hard foods. They have a narrow jaw. Parent brings them in. They're mouth breathing. They are bedwetting. They have emotional issues. They may even have ADHD. So all these things that we're seeing in these children because they're not sleeping. So what can we do? So we can start what we call our Healthy Start program. We can start at the age of 2, start developing these arches so that they're breathing better, they're sleeping better, they're doing better in school, they're socializing better. And we just prevented the need for braces and extractions and most likely an adult sleep apneic patient. So, and all the other comorbidities that go with that.
Absolutely. Whoa. Well, that's incredible. Getting at the root of it all.
The third option is similar, but now we already have the adult with the narrow arches. So we missed this. We missed the chance.
Sure.
But we can still expand them with expansion appliances. And these appliances, the 3D expansion appliances, have been used up to the age of 94. That's the oldest patient that's had them done. It wasn't my patient, but it's been reported. We were told in school, you can't, past a certain age, you can't expand the jaw. That's not true. You can absolutely expand the jaw. So why do you want to expand it? Because then you can teach the patient through myofunctional therapy how to swallow, proper lip posture, all the soft tissue that goes into this eating, swallowing, speaking pattern has to be corrected so that then we can expand the jaws and the patient's tongue can then go in its proper place when they swallow up against the roof of the mouth in a forward position instead of the back of the throat. So in answer to your kind of question, like, that sounds like a lot of work. That sounds kind of expensive. Absolutely. We give patients options, right? Everyone should be informed of everything that's possible. Let them make the option. Let them make the choice of what option they want to choose. And then the fourth thing I'll go over real quick. We do this laser treatment in the back of the throat. It's called night laze. It's a non-ablative. It doesn't burn. It doesn't cut. It doesn't remove tissue. Back of the throat, collagen, soft tissue. If you heat it up, it tightens up. So this technology was actually taken from the medical field because they were using it for women to tighten up bladders and uterus, same technology. So when you tighten up that soft palate in the back of the throat, it opens up the space again. So there are a lot of options. And then after all that, they say, I don't want to do any of that. I said, well, what can we do for you to help you? Okay, so first thing I would say, let's figure out what's happening. When we look at the sleep study, you're on your side, you're not snoring. You're on your back, you're snoring. Okay, so we got to get you off your back. Or we got to show you properly how to sleep on your back. So you can sleep on your back. And the analogy I always give, if you've had CPR training, what's the first thing you do? Tilt the head, jaw thrust, right? Open up the airway. So you have to be able to have something, if you're on your back, you got to have something under your neck that's keeping your airway open. Right. Okay, most people are just kind of buried in the pillow. And if you're on your back, usually your pillow raises your head. So you're like the proverbial forward head posture.
Yes, exactly. There's a lot of that.
Yeah, it's bad enough during the day, but now you're doing it while you're sleeping. You're not getting oxygen that way. So, and then we will talk about all the things that you talk on your podcast, all the different hacks you can do. Are you drinking alcohol late at night, caffeine? You got to stop that. What's your room look like? You got to block it out. So I won't go into all that because you do a great job informing your listeners. So we will address that also. And then Renee will address the nutrition part of it to help them sleep. And of course, God, there's so many things to look at now in terms of neurotropics and whether you're using melatonin.
Absolutely. So many.
There's no shortage there.
Okay. So first of all, so much excellent information that you just have given us. And out of all those, kind of top 4 steps that you can take as it pertains to the apneas and snoring and, depending, I know it's such a big topic because it's bio-individual and depends on the anatomy. So I know you can't possibly give kind of blanket statements. And here I go to try to get more blanket statements. Have you started to see yourself gravitating towards particular one more than the other out of those or particular groupings, or there are particular candidates that are really benefit, say laser treatment more than others? How do you think about the answer for each person of which direction they should go?
Yes, I do try to do it based on their individuality, what their interests are, what their finances are, what their commitment is. So my favorite, if none of those were issues with the patient, I would say do the 3D expansion because we're getting to the underlying etiology. So we're correcting what didn't happen, and that's a lifelong correction. So CPAP is a lifelong commitment. You got to wear CPAP forever because you haven't corrected the underlying anatomical structure. A forward mandibular advancement appliance, again, you're not correcting the underlying. And there's also some issues with the mandibular advancement appliance. You can start to have TMJ issues. And then the nightly is kind of, I almost say like a quick fix. I don't want to do anything else, but I'm willing to do some laser treatment. So you'll get some improvement. Again, it's not permanent. So if someone wants to make the long-term commitment, and I find maybe because of the kind of practice I have, being a holistic practice, people are coming in with that mindset.
Yeah.
So they're not insurance-based healthcare. They're thinking about what's the long-term etiology, what's going to help me in terms of longevity. I don't want to have to wear something for the rest of my life. I'll make the commitment. So sometimes they have to say, well, the finances are an issue, but I'll make it happen. So I kind of encourage that, but I never push one over the other. I want to really make them the choices. But if it was my choice, it was my daughter, my wife, my whatever, I would encourage the 3D expansion because it's really getting down to the underlying cause and etiology.
How cool.
Why you have this problem.
For this 3D expansion, like I'm looking at pictures and what have you, what does this look like for those of us that, so like my experience with it, I know of clients that have gone through this or who are curious about it. I've certainly not done it myself. So what does this look like? What's the timeline? What are some of the expectations? Is there anyone that's not a candidate for that? It's very, very cool step that could be taken that I think a lot of us don't know about.
Pretty much can fit to any individual unless they've got a lot of teeth missing.
Okay.
So if they're missing a lot of teeth, they can do a mandibular advancement appliance, but it's very difficult to expand because you really need those anchors to be able to do the expansion. Otherwise, it's pretty much for any individual. The timeline is typically depending on the patient, and we don't pressure anybody. Like, this is a recommended number of hours you should wear it. You want to wear it during the day, you want to wear it all night. Well, I can't wear it at night. I can't sleep. No, actually, you can sleep better if you have it in there. So, you're dealing with all those issues that patients come up with, objections, whatever. We say, look, you go at your own pace. The bottom line is it's not a race. We want to get you from here to here. If it takes 6 months, that would be ideal. And I've seen people do this in 6 months. I've seen people take 18 months. So at the end of that, they can continue to wear those appliances, or this is another, I guess, important piece, is that now that we've done this expansion, our teeth aren't coming together the same as they were before.
Yeah.
So there's a part 2 to that, and that is Invisalign or some kind of invisible aligners. So clear aligners. It can be Invisalign or anything. We don't do a lot of braces anymore. It's just because people don't want to wear braces. And why wear braces when you have something like clear aligner? So now we've done the expansion. Now we're going to bring all the teeth together so that you can chew properly. So.
Got it. Wow. Okay. Well, I'm clear that I could speak with you all day, so I'm going to try to be respectful of your time. So wanted just to hop into, since you are such a pro in this area of just the holistic approaches to health and well-being in general, but certainly with your area of expertise. I know you were sharing before that you even have people, I didn't even know that people were doing this, that you, when your clients come in, you're giving them HRV readings, and you've been doing that for years and years. I know you've got lots of cool things that you are bringing into your daily life. So we want to know, what are you doing for your sleep? So the first question for that is, what does your nightly sleep routine look like right now?
Well, it's changed.
Yeah, I know. Certainly for someone like you, I'm sure this evolves all the time. But what's your latest?
I just have to say, I thought sleep was a waste of time. As probably many of us people are in the sleep arena, like, I have too many things to do. I need to stay up to 1 or 2 o'clock to get everything done.
Yeah.
And I said, wait a minute. I can't be preaching about the importance of sleep if I'm not doing that myself. And it took a while to calm, and I still have those issues. Sometimes I get that racing mind. So I do use a series of, supplements that help me sleep. I'd say, and I use some other devices. I love the Rasha. I don't know if you're familiar with the Rasha machine. Yeah. So I think it has a great piece there. I use the Healy is another, has some good frequencies on there. And then there's a number of things that help with sleep. I probably have a bunch of them on my night table that I've used in the past and not using now, but they all have. So I really believe in energy frequencies to help calm down the brain. I mean, basically, we're talking about an electrical impulse that's occurring when we talk about going from beta to alpha to delta, theta, all those phases, or there's EEG frequencies. when we're looking at those, how do we get into those? And the best way to do that is by using these energy frequencies. Sound is obviously a very good way to do that. I do have the Nucom, have that.
Yep.
So I have a lot of things on the side. So I'd say right now, the Rasha is my number one choice. I love the technology behind that because we don't need to go into all that, but it's base 12, using base 12 mathematics, which almost everything else is base 10. So it'd take a couple hours to even go into all that. And I'm not the expert on that. So those are the things. There's a couple of products by Design for Health that I love for sleep. So I do take that every night. And then, of course, all the regular hygiene. There's no TV in my room. We haven't had a TV in our room for over at least 10 years, if not more. My wife's still not happy about that. But I mean, I have to say this. I hope she won't be offended. She is like the master of sleep.
Really?
I come home, I put my blue blockers on, I turn the lights down, I have a special screen on my laptop, I do meditation, I do the Rasha, I do all these things to wind down. She's in bed, reading on her computer.
Doesn't think twice about it. I know my fiance is like that too. It's just
wakes up with an Oura Ring score of 95. So she's a master sleeper. I am not. So I've had to use these hacks to help me sleep. Now, I did a sleep study. I do not have sleep apnea, but I'll say this as myself, about 45% of the population will sleep on it or will snore on occasion. Okay, so it's pretty, and most of that is on their back. I'd say it's probably even higher than that if you're talking about how many people sleep on their back. I do snore when I'm on my back. So I got to stay off my back unless I have the proper positioning with the pillow. So I think during that sleep process, you got to find the right position. So I have a special pillow. I have a pillow between my knees. I have the soft that I'm hugging. So
same.
My wife is like, you take so long just to get ready to go to bed.
I love it.
I know, but it works.
Well, we can learn from that because, a lot of the people listening kind of veer on the side of you on what you're dealing with of it doesn't quite come so naturally. So that's fantastic that we can learn from you. So then the second question would be, and you might have already kind of spoke to some of this, but what is on your nightstand? And it could be your proverbial nightstand, like, apps or ambiance, gadgets, anything. And I know you spoke to some, so just anything any other things we should be aware of.
Well, I do have some different devices that, you can plug in your ears to listen to, apps on your phone, whole tones. That's what I was trying to think about before. I don't know if you're familiar with whole tones. Sure. Yeah, that's a great device. So you can either use the headphones or not. I'm a little weary about anything that has Bluetooth technology. I think that kind of defeats the purpose. So right now I go to my special room in my house and I do my Rasha. And then I come back. So I'll do whatever frequencies. I'll do stress reduction. I'll do chakra balancing, emotional tones, and then I'll do deep sleep and dream sleep or REM sleep. And that helps me just fall right to sleep. So I had no problem falling asleep. My biggest issue is if I wake up, and I want to touch on that real quick before we take off here, is difficulty getting back to sleep because I'm thinking about all the things I need to do at the end of the next morning. So one ritual I do try to make sure is I do my to-do list before I go to bed.
Smart.
Because I wake up and I think, I'm going to forget these things. Touch on the fact that many people wake up to go to the bathroom. Mm-hmm. They think for women, it's bladder issues, men, it's prostate, and those are some issues. But there's something called ANP, atrial natriuretic peptide. Mm. We release that to the kidneys. If we're not breathing properly, the body releases certain fluids and it feels like the lungs are filling up and the heart's beating harder and it releases this peptide and it causes you to have to go to the bathroom. So you're going to release the fluid by stimulating the kidneys. So a lot of times that's what's waking you up. The reason I bring that up is it is directly related to sleep apnea. So to no other reason. If you're not getting enough oxygen, the body senses that, grinds your teeth, maybe you gasp for air, or wakens you to go to the bathroom. You're thinking, oh, I just have a prostate or bladder issue, which you might, but.
Yeah. Well, thank you for saying that too, because I think that can go into the multiple things that might be signs that we want to take those steps to get that sleep study or what have you, because those wake ups, I have so many clients that they literally come just because they're getting so frustrated by those wake ups or they blame it on the bladder, the prostate, the whole they go through the whole litany of things. They stop drinking water or liquids. I've got one client that I'm working with that stops drinking water at 5 p.m. This is all of these practices that if we're not being mindful of some of these other things that you're pointing to, then we might be missing what's really there and falsely attributing it to something else like, oh, I just need to go to the bathroom all the time. And there might be something else there.
Well, if we're sleeping properly, our brain should be releasing antidiuretic hormone. So it's kind of like going into hibernation. So, how does a bear go into hibernation for 6 months and not have to defecate or urinate? So we can't go 6 hours without having to go to the bathroom. So again, I would start to look at, is there some neurotransmitter issues? Also, I would talk about GABA, which is the only inhibitory neurotransmitter. So you might be GABA deficient. So, I think there's such a vast array of things you got to, it's almost daunting when you think about all the things you got to. So I want to say to your listeners, don't feel bad. And I'm sure you do too, Molly. Yeah. We've all gone through all these things and we're constantly looking at new things. So, it doesn't really end. Oh, I want to say, I do want to put a shout out to the AMP coil. AMP coil is another really great device. Yeah.
Oh, that's perfect.
Yeah. Oh, and by the way, because of your podcast, I did order Hap B.
Oh my God. Look at you. That's amazing. So great, actually. And it's so funny. I still have to test it. I have it sitting. I have a whole box. I should show you. Again, you might be able to see. I have a whole, can you see that? It's like tower. I have a whole tower of things I need to go through. I've been in Sedona and hopping around. So I'm actually behind on my gadget testing. So maybe we'll be testing around the same time. So we'll have to.
Okay, we'll keep in touch about that. It sounds like a great device. I think I'm looking at it like for that time when I wake up in the middle of the night, that might be a great time to do it. Yeah. And during the day, I have a pretty stressful schedule. I do a lot of surgery. So I'm in sort of a sympathetic state most of the time. I gotta be. You don't want me doing surgery in a parasympathetic state.
No. Yeah. So totally thank relaxed. You for thank you for being today? I'm kind of sleepy. Yes, please stay on alert.
So I think that's going to be a great device. I think also for my sleep patients. Yeah. Because one of the things I find out quite often, I address the sleep apnea. Yeah. Now they address the sleep apnea. Wow, I'm sleeping through the night. They're not as tired. Now they have insomnia.
Yes, exactly. Now they have the energy for insomnia. Absolutely.
Right. Yeah. So now they're like wide awake.
Got it.
I think this might be a great tool.
Well, so fantastic. We'll have to connect more on our experiences with that. That's great. And then I would imagine since you've been so engaged in this topic, our last question would be, what would you say out of all of these things has made the biggest difference for your kind of sleep game or your biggest sleep aha moment in your life that has really kind of changed or moved the needle for you in that area?
Wow. That's a tough question because
it is. Yes.
And I get this question a lot, like, did this thing really work or that thing really work? I mean, I think because I do so many hacks, it's really difficult to push the needle. I know. Yeah. So I would keep it simple for most people. I think, looking at your body temperature, so I love to do the infrared sauna and then jump in a cold shower, go to bed. I think that's a great hack. Keep your room temperature down. Do the things that are simple and free. Well, infrared sauna is not free, but I guess you could
hot shower, take a
hot shower and a cold shower. So keep those things simple. Make sure that your environment's correct. Make sure you're not going to bed mad. Make sure that you've kind of released all the emotional stuff from the day, that you can calm that brain down. Yeah. So, and then if you suspect sleep apnea, for right now, stay off your back.
Yes. And then get in touch with your dentist.
If you have to tie tennis balls to your back to keep you off the back, I would do that.
Absolutely.
So, I'll just say real quick, I do recommend mouth taping, but I do recommend a thorough evaluation of the nasal passages. Make sure people are breathing adequately through the nose before you start taping up the mouth.
Yes.
Because that may be your only source of oxygen. So.
It's very important. Good call. Yeah. Okay. So much information. So then what's likely is that people listening to this want to know more about how they can follow you. And are there options if they're not local? Do you have kind of telemedicine options or things that people can do virtually?
Absolutely. And I do that all the time, just like we're doing right now. I can't fix your teeth through telemedicine.
Yes.
I can't take your teeth out. I can't do those things, but we can talk about sleep and we can talk about sleep apnea. Or I could be an adjunct to someone who's local to you.
Yep.
So more as a coach, like these are the questions you want to ask. So they can reach me at Dr. Sam at julianctr.com, or they can go to the sleep site, which is the Julian Center for Effortless Sleep.
Beautiful.
So,
and
I'm going to reach out to you. Hopefully maybe we can do some links to your podcast on my website.
Oh, I would love that. Thank you so much. And I'm excited to be able to be in partnership with you and share, just to provide more and more resources for people that are at that crux of, how they kind of need that Sherpa to guide them. And I know you're definitely that person. And also be sure to follow on Instagram as well and different social media platforms. So we'll be putting all of those links into the show notes too, because I know you got lots of great information. And of course, in partnership with your daughters who are just rocking and rolling on their health crusades as well. So it's a whole family affair.
Yeah. And, it's great to link up with you and people of like-mindedness and passion towards this sleep issue, especially now with this, we call this, I hate to say, even use the word COVID. I would just say this state of fear that people are in, and that's affecting their sleep. And then, we know for sure if you're not sleeping, a couple of things that happen for sure is our lymphocyte levels go down. So our immune system's much more prone to infection. So if you're exposed to, it's not just COVID, it's everything. So, I'll just say, I want on a closing, what really got me interested about sleep, what changed me more than anything, when I saw that 40% reduction in your testosterone levels.
Yes. Way to take it home. Exactly.
I'm like, that can't happen.
That is, I know, and so many men end up getting testosterone replacement therapy as they age and what have you. And so you're speaking to such an important point that I think so many people don't realize that that's such a fantastic and important and root place to start. If you get back those readings that your testosterone levels are low or concerned about that, begin here. So absolutely.
Let's start with the easiest thing before we start doing testosterone injections or pellets or whatever.
Yes. So great.
Anyway, I had to add that because I forgot that was a major influence for me.
That's huge. And because exactly half of this is about the motivation to take all of these steps to implement all of these things, because if we don't have the strong why, people are not going to do all of, the frequencies and the setting, the blue blockers and all of these things. But you tell them about testosterone, they're committed, they're in. So
that's a big motivator.
Yes. Thank you for adding that. Well, I really appreciate you taking the time. I know you're in between, surgeries and all this stuff that you're doing to really make a difference for people. So thank you. And looking forward to more in the future. Hopefully, and in the future, we'll be able to, Paleo FX and all of those different conferences that I know you guys frequent. So looking forward to it.
Can't wait till we get back on a normal schedule. I'm ready to out travel anywhere. It doesn't bother me.
Yes. We're in it to win it. Absolutely. Yeah. Well, more to come.
This has been great. I enjoyed speaking to you. Thank you for all that you're doing. Your audience should be very grateful that you are making such a passionate commitment to this, because it's so, so important.
Oh, well, thank you. All right. Well, enjoy the rest of your day. Appreciate it.
You too, Molly. Take care.
Thank you. You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.